So risk assessment is central to mental health practice. What we're interested in this study is risk assessment following self-harm. So that was when someone presents with self-injury or self-poisoning to hospital. We know from our previous work that risk assessment tools or checklists are in widespread use. But one of the questions we're often asked is, what is the best tool? So in this study of about 500 people across England, we tested 5 risk assessment scales, and we tested them in comparison with a single question, just asking the clinician or the service user what they thought the risk might be. And what we found was that that single question, just asking the clinician or the service user, was as good as any of the risk scales. But in fact, none of the instruments were good enough to be used in routine practice. The positive predictive values were low. What does that mean? That means that about 20% of people who went on to repeat were missed by the instruments. And less than half of people rated as at high risk went on to repeat. So they weren't very good in terms of accuracy and probably aren't useful in practice. So what do our findings mean in practice? Well, our findings are consistent with the national guidelines, which say that risk assessment tools and scales shouldn't be used solely to determine management, so who gets treatment and who doesn't. So they're consistent with that. And they're consistent with this notion that really risk assessment as risk prediction is a fallacy. You can't really do it. So the question is, what should we be doing instead? Well, I think we should be focusing on doing the simple things well, so providing high quality care, focusing on the therapeutic aspects of the assessment. We should be thinking about risk assessment not as an end in itself. So risk assessment is important, but it leads to how we might understand risks, how we might formulate risks, and most importantly, into a management plan. And we need to recognise that risk assessment is individual, so each individual is different and each individual has a different, if you like, risk profile. And perhaps most importantly, we should be focusing on needs. So it's not just about risks, it's about patient needs and addressing them in a high quality treatment plan. So to sum up, really, what we're talking about here is that perhaps risk assessment tools and scales aren't particularly useful in practice. And this notion that risk assessment can somehow be risk prediction is a bit of a fallacy.